Removing contraceptive implants. There are several ways to remove contraceptive implants. This video shows the longitudinal and the perpendicular approaches, as well as the modified U method for rods that are more difficult to remove. The best approach causes the least trauma to the woman's arm. Explain the procedure to the woman. If she wants to continue using the implant, a new one can be inserted through the same incision. Preparation is similar for all approaches. Gather your sterile instruments and supplies. Ring forceps, a drip with an opening, a number 11 pointed blade, curved mosquito forceps, gauze squares, a small metal ball, a syringe with needle, and bandage materials. Have a bottle of local anesthetic, such as lidocaine 1%, and a waterproof marker nearby. Then, pour your antiseptic. Clean your hands. Then, position the woman's arm. Locate the rod by feel. If you cannot feel the implant, refer the woman to a provider with experience in difficult removals. First, mark the incision site. Put on gloves. Then, clean the incision site with antiseptic. Apply it in a circular motion from the inside to the outside 2 times. Let the betadine dry completely. Then, draw up 1 milliliter of lidocaine. Now, here is how to remove a 1-rod implant with a longitudinal incision. Press on the far end of the rod to make the close end bulge into the skin. This is where you will make the incision. Make a line on the skin right on the bulge of the tip. Give a small amount of anesthetic under the end of the rod. When the site is numb, make a tiny 2 to 3 millimeter stab incision right at the mark. This incision is longitudinal, in the same direction as the implant. Use your fingers to push the end of the implant into your incision. Then use the tip of your blade to gently nick away at the fibrous tissue that has formed around the end of the implant. Once the fibrous tissue is loosened, the implant will usually pop out of the incision. This method is preferred because it causes the least tissue damage and is usually quick and easy. Next, a perpendicular incision is used to remove a 1-rod implant. Press the implant to locate the end of the rod near the elbow. Make a mark close to and perpendicular to the end of the rod. Inject a small amount of anesthetic just under the end of the rod. When the site is numb, make a small incision at the mark. Push the rod toward the incision. When the tip is visible, grasp it with your curved forceps. Scrape fibrous tissue with the dull side of the blade to free the rod. A 2-rod implant can be removed using a longitudinal or perpendicular incision. And last, we show the modified U technique. It can be helpful for a more difficult removal. Modified vasectomy forceps with the 2.2 millimeter ring works best for this procedure. First, mark the incision site. It's directly over the middle of the single rod. For 2 rods, the incision site is between the 2 rods and 1/3 up from the end of the rods. This is a 2-rod removal. Draw up 1.5 milliliters of lidocaine. Inject equal parts at the incision site and under each rod. Check that the site is numb. Then make a 4 millimeter stab incision at your mark. Bluntly dissect the tissue by opening and closing curved forceps to the depth of the rods. Gently push the vasectomy forceps through the incision in the direction of the first rod. Guide the rod and vasectomy forceps together. Open the forceps and grasp the rod. Then slowly pull it towards the incision. Remove the fibrous tissue coating the rod by wiping with gauze and carefully nicking it with the blade. Using curved forceps, grasp the rod and pull it out in an upside-down U shape. Use the same procedure for the second rod. For all approaches, measure the implant to be sure it is complete. Show it to the woman. Close the incision with an adhesive bandage. Apply a gauze square on top and secure it by wrapping a length of gauze roll snugly around the arm. Advise the woman to keep the site clean and dry for 2 days. She can then take off the outer gauze dressing. The tape can be removed in 5 days after the wound is healed. If you are not able to remove an implant within 30 minutes, stop, cover the incision, and apply a bandage. Have the woman return when the incision is fully healed in 4 to 6 weeks to try again. If you have removed 1 of 2 rods, advise her to use condoms or not to have sex until she returns. Remember, the anesthetic goes under the tip of the rod. Make a tiny incision. Use the approach that causes the least damage to the woman's arm.